So we are on the record. Thank you so much for coming today, guys. So I'm gonna just demonstrate the skinning today. Like I said, we start off with sharp dissection technique. So you see how I'm using my hand, my finger already, to sort of gain access. Are you Are you see? Are you looking, my good friends, like this? I chose a cat that might be hard for me. You know what I'm saying? I think it might be hard for me. Okay, so I've gained access. So you must always use, are you listening? With the blunt end of the scissors towards the cat, obviously to avoid damaging the muscle below, right? And when you're cutting, you must cut with the upward forward motion. The upward motion is to remove this end of the scissors from the muscle, and the forward motion is to do the cutting, okay? Okay, so there's that. And when you're doing this, in order to remove the, you see how we can see the blood vessels already? You kind of use your thumb to kind of collect all the connective tissue, okay? Okay, so sometimes you go like this, you close it. You see, instead of opening my scissors, this is what I'm doing, okay, like that. And then I could do this as long as my scissors is you know. And you see how you could already see the muscle fibers. This is the pectoralis major muscle, major and minor down here. You could already see the muscle fibers already because I'm using my thumb to collect all the connective tissue. Because if you leave the connective tissue on the cat, it's going to be nice and white and you won't see the muscles underneath. So the muscles are kind of tan colored. They exsanguinate these cats, which means they remove the blood from it. So the muscles will be pale a little bit, okay? But there'll still be a little flash of a pink, they'll be still kind of sort of like that, So what's that? So this looks like it's female, so it looks like it's got some mammary glands that I may be removing here too. I may have to remove them at the end. Okay, so this is a female. Cut with an upward forward motion. Okay, so this is the mammary gland. You could see the veins already. The veins will be tagged blue and the arteries will be tagged red. You understand? Then there are special blood vessels in the abdominal area called portal blood vessels that carry blood from the digestive organs and direct it to the liver before it goes back to the heart. Those are special veins called portal, which is called the hepatic portal system, and they are tagged yellow. Okay, they're still veins. The fact that they're called portal veins because they are carrying blood from the digestive organs, carrying it to the liver first, because the liver will edit any nutrients that we get. It will change some amino acids into other amino acids. And number one, number two, it will detoxify. Let's say you happen to eat some poison or something like that. It's going to be detoxified in the liver before it's distributed systemically. You understand? So all the blood, once you absorb, has to stop at the liver first. So those blood vessels are very important because they gotta take the blood there to the liver. It gets worked on. It gets conditioned. So the liver is a conditioning organ because it will do something to the blood. You know what I'm saying? Like the kidneys, also another conditioning organ because it will remove the metabolic waste from the blood. Isn't that cool? So this one is female, obviously. So I might remove the mammary gland together with the skin. normally, if this was male, I would skin the scrotum. I would remove it, and so that you would have the testes remaining and the spermatic cord. But this one is female, so we won't be getting any of that. Do you see those blood vessels? You could see the muscles. Do you see? You see? Because I'm removing. So, like this. Do you see that? With the, I'm not, so you see, I have to be careful now. You see what I'm saying? You know what I'm saying? So then we cut around here. You see how I could use my, so I used to have you guys do this, but it ended up that you guys were taking so long. See? So there's that. Oops. Oops. I don't want to splash myself. Some of these blood vessels will be like deep in there. Okay. Okay. Bing, 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 it's funny. It's not facing you. You saw the face. Normally they would have some one of the things I'll tell you to be careful about, because sometimes they put like a sponge on there. The teeth can be sharp if you know collide with it or something, or you bang your finger. It could pierce your lips, so be careful. But other than that, it's okay. You know what I'm saying? You see, I'm using the open scissors technique, but without opening it, because I'm using my blunt and scissors. Do you understand? Do you see what I'm saying, my good friends? I'm demonstrating the open scissors blunt dissection technique, but and then obviously I'm alternating with the sharp dissection, because then I'm cutting the skin with the scissors. You know, when you close the scissors, that's when you perform the cutting action of the scissors by closing it. You understand? So that's why the open scissors is a blunt dissection technique, because the scissors doesn't cut when it's opening. You see what I'm saying? But like I said, because even if you're using a blunt, you know, or rounded or curved scissors, when you open it, it will still have one of the ends will be sharp. You understand? So you don't want to do that, because then you'll be exposing one of those sharp ends, and you're now already using sharp dissection techniques. You understand? So there it is. What's that? Did you drop it? Did you drop your phone? Oh no. they will be skinned. So you don't have to do this, but I have to demonstrate for you guys and tell you how to cut. And some of those things uh, will be in the. You see, this one was already cut here for some reason. You know what I'm saying? Because I wasn't even using a scissors in this area. There's one end where they would have done all the infusions that will be kind of torn. Okay, so when we are doing our actual dissection, we want to make sure we avoid this part. You see, this is where they did the infusion of the blood vessels. Are you listening? Especially the portal system. You see, this is where they sutured it up on the top, and this is where they cut. Do you understand? So, in your dissection, I do not want to see straight. Are you listening, my good friends? I do not want to see a muscle that is a straight end that is cut. It means you cut the muscle, and with a sharp instrument, and that I would deduct points for doing that, major points, because that's the whole thing. Is we don't want to see cut muscle. They did it because while they were infusing the cat, you see what I'm saying, and they sutured the skin on the outside there. You understand? So when we dissect one half of the cat so that we leave the other half as a reference. You understand? So we're not going to go on this side, right? So that's one of the things you want to watch when you do your cats, because they will have infused them, is you leave that side, so you do this side, because the side doesn't have a cut. Okay? So you understand? We don't want to dissect all over the place, because then we want a reference point to say, okay, this is what the cat looks like, and this is what it looks like after we've dissected. You understand? So I'm gonna cut the skin covering the vagina and the anus, and then just take it off so it's nice and clean. You understand? You see? There's the two holes right there. One vagina, one anus. Again, these cats, they kind of make my nose run a little bit. But I try to blow my nose regularly, so I'm just warning you, giving you a warning shot. You know what I'm saying? Yeah. I would recommend you would cut first and not do what I'm doing. Can I please have? No, that's okay. Can I please have it's a bone crush cutting tool? It looks like a pliers. That one. Exactly. Yeah, put it down because my hands are wet. You know what I'm saying? So I'm cutting it short here. You understand? Oh my God! Looky here. What's that? Oh, I gotta go back to the movie. Go back to the movie. Some of this. There's like a thin muscle that twitches the skin, so we wanna make sure. So we kind of removing it with the deal. This one looks like it's a pregnant female actually, because the mammary gland. Yeah, for the most part, some of the times, the females that we get to. You listen. The females that we get to dissect, some of them are pregnant, and I'll show you. The cat litter doesn't grow in the uterus like the human being. It grows in the fallopian tubes. That's why a cat can have like multiple, like 4 or 5 cats or kittens at the same time. Because it grows in the fallopian tube. The uterus is very small. It doesn't really carry the fetuses, So you will see that there will be little balls on the uterine tube as it's going to the ovaries. You can see the ovaries too. You know what I'm saying? We don't do some of those systems, but I do show it to you, and I will show you the urinary system as well, because we do see the kidneys when we're doing the abdominal system. When we're doing not the abdominal system, the digestive system in the abdominal area. Very good. You see, my scissors is a blunt dissection instrument because once I close it, you know what I'm saying? I could do that. So you see what I'm saying? I'm using blunt dissection techniques and at the same time alternating between blunt dissection and sharp dissection. You understand? For me to blow my nose, I would have to wash my hands and take my gloves off, and it would delay things. So try to be as you will be my the surgical nurse. The surgical nurse, when the doctor is sweating, he'll wipe the sweat. You know what I'm saying? And the surgical nurse has to make sure the instruments are the proper instruments. Some of my students are surgical nurses right now, actually, as we speak. I don't want to. You see what I'm saying? You know, I tell my students that one of the days you'll be my nurse or my doctor, and they'll be laughing at me, right? So I go to my annual physical. Guess the nurse who took my vitals was my student. Hey, I'm not even lying to you. It's the truth. You see what I'm saying? So you guys will be working with humans. So this is why we don't sort of give you a buy in this class and say, oh, I'm just going to wing it. You've got to know what you're doing. Because you guys are going to be the future nurses, the future doctors. You'll be taking care of us. You know what I'm saying? So I want to make sure that I want to run to my student because I know what they can do. And so I don't want to be running away from you. No, not that one, because I knew what I knew how they did in my class. I'm not going to that one. You most likely won't get to that stage if you were like that anyway in the first place. But I'm just trying to prove a point, you know what I'm saying? Yeah, because you guys will be working with actual human beings. You can't be like, oopsie, you know what I'm saying? You kill somebody. Yeah, it's true. A motor mechanic, if you ruin a part, you might get another part. But a human, you couldn't do that. You see what I'm saying? So you have to hold yourself to that standard, even when you're studying. You understand? Because, yeah. You see what I'm saying? You have to hold yourself to that standard. Saying, okay,